So, thank you for doing this interview with us today, Morten. Could you tell everyone a bit about yourself quickly, please?
Yeah, I'm an adult neurologist
Yes.
and a professor at Oslo University.
Yeah.
And I'm working at the National Center for Epilepsy in Norway, and I also head the research group at the center.
So, tell us about your research or your specialization.
Well, actually, I started out with the AED or ASM, so I did a randomized control study back in the 90s. But now, recently, I've done studies on psychosocial issues, I would say, in epilepsy, in patients with complex epilepsies, but not necessarily rare epilepsies, but those who have refractory epilepsies.
And this is adult.
Yeah, I'm mostly an adult and adolescents, also an adolescent. So,
And so what part are you playing with when it comes to EpiCARE?
Well, different parts, but I have started quite very recently a new working group on the psychosocial issues in epilepsy, because I've been part of the Epilepsy, which was the pilot before the EpiCARE. I've been part of it for many years, and it's a great network, but it has, of course, focus, and that's not strange at all, on the very rare epilepsies, and therefore also on the infants or the child or young patients. But I would also like to have more emphasis on the older patients or the adolescent, and not only those with very, very severe epilepsies, like the monogenic epilepsies, but also, as I said, those who are struggling with their epilepsy, but have normal intellect but have huge problems in their daily life.
And what sort of challenges are we talking about?
There's so many of them. Of course, they have a great amount of comorbidities, like depression, anxiety, kids with ADHD, behavioral.
Autistic traits.
Yeah, that too. Of course.
Yeah, personality disorders, mood problems.
Yes.
Yeah.
And of course, they have also challenges at school. Although they might have a normal IQ, they still have problems. Many of them have dysfunctions in their frontal lobe. There is a working group working on that, so we will not have a focus on that. But and this results in problems in all domains of life, I would say.
So when it comes to things like relationships as well.
Exactly, and sexuality, we have done some research on that field too.
So we can talk about things like that?
Yeah, I hope so.
We are animals.
It's very important. But I didn't meet a lot of patients. But even if I have written some together with my co-workers, of course, papers on sexuality, I still forget to ask the patients, especially if they're young. In a way, if they're in the menopause or a bit older, and I might ask about it. So it happens that people or patients stop in the door and say, "I don't want to watch."
I've heard this a lot.
And then, I think we should be better asking these things.
Okay, lovely. So nothing is off limits?
No, it shouldn't be. No. So this group we have just started, and it's a small group, and we will focus on the adults at the beginning, but of course we will include the children later, but we try to sort of produce something. So what we are aiming at, I think, but I haven't had the first meeting yet. I just have had some informal meetings with most of the groups. So we will start with this. We know there are quite a few questionnaires that can identify psychosocial problems and also lack of medical adherence, because that's a huge problem. We published on that, a PhD candidate of mine published on that, and it showed that patients often, of course, forget the medication, but some even do it on purpose. And that's
for multiple different reasons as well.
Probably side effects and other things.
Yeah.
So that is also one issue that we will cover, of course, the side effects of the anti-epileptic drugs, because they might cause more problems than the negative effect might, in some cases, be
well, sometimes depending
worse
on
than the positive.